Many diagnoses in various areas of medicine and biomedicine are often complex and expensive and include an extensive sequence of steps. These steps can be highly complex, compromising diagnostic performance, especially in remote regions of developing countries. Quick access to patient information and exams, in an organized, decentralized, and distributed way, is very important for the medical community in general. The use of these data by diagnostic support systems can increase the accuracy of the result. The development of computational models based on the specialist doctor's perspective aims to transform clinical information into knowledge. To propose the creation of more efficient diagnostic aid systems. This definition aims to facilitate the data analysis process and allow the formalization of information related to each diagnosis. The computational concepts used to create this technology are linked to knowledge engineering. With the automated analysis of information banks. The aim is to establish the degree of relationship between a specific diagnostic context and a given patient and their respective symptoms. In strict terms, knowledge is only created by individuals, and organizations need to support creative individuals or provide them with appropriate contexts. This process must be understood as a factor to organizationally expand the knowledge created by individuals, crystallizing it as part of the network within the institution. It is also observed that this process occurs within an expanding community of interaction, which crosses interorganizational levels and boundaries. Ontology can be defined as an abstract and simplified explicit specification of a domain to be represented. In the area of intelligent systems, if an entity can be represented, then it is an explicit specification of a conceptualization. Thus, conceptualization is defined as the structured interpretation of concepts and relating them. In this case, those selected as relevant in a given domain are referred to. The term explicit refers to the set of these terms used and their restrictions are previously and explicitly defined. The importance of formalizing an ontology refers to the ability to process it by the computer, which excludes definitions in natural language. Its sharing is justified because it describes consensual knowledge used by more than one individual and accepted by a group. Thus, an ontological structure is the union of a non-empty set of attributes, concepts, and specifications in opposition to hierarchies, with the basic function of representing the domain through relationships and axioms. The level of knowledge provides the means to rationalize the behavior of a system from the point of view of an external observer. Formalization is established through an agent who has the intelligence to complete its objectives. The agent can execute a set of actions and choose them according to the principle of rationality. A model at this level of knowledge, however, is not only composed of the domain that the agent appears to be using but, more importantly, is the structure within which that knowledge is being used to achieve the goals. A diagnosis aid system has two aspects that influence its effectiveness. The first is associated with the information processing methodology, and the second is with the presentation of results through an intuitive interaction with the user. A single environment, which is primarily ergonomic, would enable the exploration of all related data within a large hybrid universe, with images of different types and textual information. Or even structured, which would allow research in different sources of information, support diagnosis and/or health research.